And so you will recall that right from his earlier broadcast, he mentioned that he was instructing some ministers get either some legislations passed or some executive instruments issued and gazetted. We just want to give an update for the avoidance of doubt this morning. The declaration of public health emergency for COVID-19 pandemic, Executive Instrument 61, is currently in force. It was gazetted on the 23rd of March at the signature of the Minister for Health, the Honorable Kweku Agyeman-Menu, Member of Parliament. And it is pursuant to subsection 1 of Section 19 of Act 851. So the Public Health Act, Act 851, which gives him the power to declare a public health emergency. And based on that declaration, also now quarantine persons, which would ordinarily be against that person's liberties, is in force. And so we want to encourage for our colleagues, if it becomes necessary that you are asked to either self-isolate or to be put in a quarantine facility, there are laws that back it. Shortly, I'll show you some of the sanctions if we also do not apply. At this point in time, we're asking everybody to comply with authorities. But this is for the evidence of doubt. EI 61 is now in force. What gives us the power to quarantine persons who have tested positive and also to restrict their liberties while we are supporting them with treatment. The President also asked for the enactment of an act known as the Imposition of Restrictions Act. As I'm sure you have followed, Parliament has enacted that. The President has gazetted that as well. It is that act that gives the broad framework for the imposition of further restrictions on the broader Ghanaian population. To do that, the President has had to issue two different executive instruments. EI 64, which was gazetted also on 23rd of March 2020 under the signature of His Excellency the President Nana Addo Dankwa Akufo-Addo, and EI 65, which is the latest that imposes the restrictions on Greater Accra and Greater Kumasi, gazetted on the 30th of March under the signature of the President of the Republic, Addo Dankwa Akufo-Addo. These two are available. We'll give you copies so that you can also, as part of education, make it available to the general public. Most importantly, the sanctions for non-compliance. And we'd like to draw your attention to one of those sanctions may be. The Ghana Police Service, leading the joint security operation, is under instructions that persons who do not comply with these restrictions don't have to be beaten or subjected to some inhumane treatment. They have to be... My understanding is that that is the head of prosecutions of the Greater Accra Regional Police Command. I think it's Chief Superintendent Donko. And there are sanctions, as we have mentioned, and these sanctions will be applied if you are caught violating these restrictions that have been imposed. It is in our own interest, and so we kindly ask the entire population to comply. So we will take your questions and have an opportunity to respond to them, and acknowledge some of our colleagues who want to also contribute to the COVID-19 relief. So if there are questions, may I ask for the microphone to be set up as we prepare to take those questions.
So please, the front line of the fight against coronavirus is your front door. If you cross, you are likely to be infected. So please,
So please introduce yourself to us and let's hear your question.
I'm Joseph Akabli. I work with Joy News. My first question has to do with the PPE distribution. I just want to find out whether it includes the private sector in terms of health facilities within that sector. If yes, how far have we gone? If no, why? The other issue has to do with how many test kits we have available, and I'm asking because we have for some days now been embarking on the enhanced testing. And finally, is there any specific plan beyond the imposed restrictions to ensure that the regions that have not recorded any case don't record cases? Because we have 5 regions now. Just ensure that we don't have it moving into many other regions. Thank you.
Thank you. Good morning. I'm Selom. I work with TV3. I want a little bit of clarification. I think when Dr. Bedu Sarkodie was speaking, the travelers under quarantine, he mentioned 89, and then the total he mentioned 214. I don't know. That's what he said. So if he can clarify that for us. And also, last time when we were here, people asked about transportation, and then you said Ayalolo was working. But as at yesterday, they passed their buses.
Yes.
So we want to know what government is doing, because we've seen situations where trotros have not observed the social distancing, and then passengers have been asked to get off, including essential workers. So we want to look at that. And also, government has put in place plans to take care of KIAs. But there are also concerns of others who do not fall under a group, maybe a truck pusher or something, who does not have a place to sleep. What are the plans?
Okay.
And when you go to our markets, social distancing is not being observed. So what is the strategy in terms of public education for those people also? Thank you.
Very well. There were 2 other hands. Yes, madam. Yes, sir. Star FM or GH1 TV? Yes, please come forward. So, Dr. Bedu Sarkodie, please be on standby. You help clarify the numbers. Health service. You also help me deal with the PPE question that yes, madam.
Good morning. My name is Hawa from City FM and City TV. Now, first of all, I would want to find out the issue to do with the PPEs. Just last night, doctors at Kolebu, the emergency department, said that they don't have enough of those PPEs and are threatening to withdraw their services. Yeah. So up with that. And then secondly, one colleague mentioned frontline health workers. You see them queued at bus terminals waiting for chotros, which they are not getting, because there are instances where a car from Medina cannot go past Ponglo, and you have essential service providers in that bar. What is going to happen to those people? Thank you.
Thank you very much.
Thank you. My name is Joshua Nanakwame. I work with GH1 TV. First of all, I would like to have some clarification on the mode of communication with regard to the contact tracing and the mass testing. Because I was in Ayawaso Municipal Assembly on Monday, and on Wednesday, there was a challenge. The residents or community members we spoke to at some point, many appeared oblivious of this particular exercise, and so some were wondering, should they stay home because those who have the pass to actually go work would have to leave the house, and those who are not aware, because of skepticism, they would have to close their gates or doors to anybody who come in, regardless you have an identity or not. So how do you take care of this exercise? And secondly, I would also want to find out, we are hearing a lot of numbers, conflicting figures as to how many ventilators we need now, and how are we intending to procure them, because the countries that we want to get these ventilators from are equally grappling with the situation and trying to find some ways to manufacture same. So how are we actually going to get them?
Just clear up something for me. There are conflicting numbers on how many ventilators we need.
Yes.
Which numbers are these?
We are hearing that we need 1,000. We are hearing.
Who is saying this 1,000?
Yes. There was a report on air on our Accra-based radio station. We heard that they need 1,000. Some are also saying that we
have to be quite clear what getting these
yes,
from,
exactly.
So that we don't confuse them.
We're also hearing that we have at the moment we have about 61 altogether from the regional. So just so, because we are also putting out information, so okay. Just so we get the average, how much we have now, how many we have now, and how many we would need.
Let me just get into it. So Joshua questions, I would invite Dr. Abuaji. How are we dealing with communication to support contact tracing in the local communities, especially with the example that he cites? And then maybe have to go over the ventilator numbers for us, whether indeed there's a projection of how many we need and the numbers as we have them now. I think one thing I missed out is that to assist contact tracing, an executive instrument gazetted on the 23rd of March 2020 to establish an emergency communications system and allow us to use some technology over the mobile phones to reach out to persons who we know fall within the primary databases that we are looking, but who we are having difficulty in reaching out to, was also issued, and now it allows contact tracing teams to use that technology to reach out to them. Dr. Abadi, please join us and let's respond to these questions. Okay, you can do that.
Okay, thank you. I think I'll start with the PPEs in the private sector. Yes, as I mentioned, we've had engagement with the private sector. We've had challenges with PPE, not just as a country, as you know, it's a global challenge. In the initial stages, facilities have engaged private sector and shared, and we are hoping that they will continue as more can. The challenge is that we have shortages everywhere. We're working, I'm sure when we ramp up the local production, everybody will be supported. We also, it's about also the essential workers. I can speak for health workers. We had encouraged all to come up with their ID cards, and for those who did not, who had lost their ID cards, we created an opportunity over the weekend for them to get their ID cards. We are asking and encouraging all facilities where they can arrange transport, pick people from the vantage points. We are engaging the associations, I met the midwives associations, and these things are ongoing to that we find out solution to these ones. On the issue of ventilators, I think we need to be very careful. People are branding figures, all kinds of experts are branding figures everywhere. But it's a projection based on where you get to, how many bad cases you're going to get. And so, as we speak, we say if you put both public and private, we can raise up 200 ventilators. And I mentioned some of them. We have 307 ambulances that has ventilators, and in the event of challenge, we could assess them and to use. We are putting procurement of 50 additional ventilators. And as you are aware, even if you have money, it's not easy to get a ventilator these days. And 20 are in, and we are hoping that as the situation, as we forecast, we will continue to ensure that with time, production will be enhanced and we'll have access to more ventilators when they are needed. So our objective now is not waiting for the West. That's why His Excellency has instituted such early measures to allow for early detection and containment, because nobody wants to get to the stage where you need 2,000, 3,000, 100,000 ventilators. That will not be there. So I think I've answered. Yes, the communication of the contact tracing. From the beginning, we had mentioned that we're doing contacts of all those who are contacts. We will come to their homes, and we will do a periphery around the area where you are, but it's not compulsory. It's voluntary, where they could do test for other possible community transmission. When you have a community that may have a lot of positives, that tends to be quite intensive, and see a lot of tracing going on around your community. But we've not had similar problems in other places, and so it depends on how it is. And as we continue testing, as new become positive, their contacts will be traced, and so the intensity will depend on how many positives are in the area. But like we said, it is voluntary, but it's in our own interest to ensure that we get tested. There are people who are asking to be tested, and if they fall within the parameter, we test them. And that's how we so far done about 6,000 tests so far.
Answer Albert Nassino, particularly Apomudin Juma reports Nibi say Toribia car mutim no say a sign car no near there who can be a fadia muyo but on bit me can we tree am
let's say you have kind of or your health worker say Omo modern answer be kuta ID card. I bet you say we a health worker, for example. Sebe ya bibi eni a ebitimi isolate you free. And I say kuta ID card there. Ebe ha dwenti na weekend on Saturday and Sunday no. We create opportunity say wow ID card ayi bia bra. Ni enye bi ma. Na me engage all hospital say wa obi oni ID card be omunye system say ba betimi produce bi ama. Sebe ya oduro baby I stop wa obetimi dey actually say me a health worker. And yes, will be answer ya me a health worker na a jam. And I also try hospitals and say more bit vehicles, so Munya na Muntimun Peki and Crofo and especially when we manager.
And the PPEs, private sector included?
Yes, initially you have shortage, so definitely like I said, everybody obia ain't enough. In the same minister, especially in Accra and parts of Kumasi.
Doc, thank you. Dr. Bedusakode, please join us and let's clean up these numbers. I think I also got notification that some number of 214 is running on some TV platforms. If you can just clear it up for us. Where are we?
Thank you very much. For clarity, the case bed in Ghana, in total, all confirmed cases stand up to 204. And this distribution, Greater Accra, we have 183. Northern Region, 10. Ashanti Region, 9. Upper West Region, 1. And Eastern Region, who just joined the number of regions reporting cases. The travelers, I mentioned 89 being a combination of the travelers in quarantine in Greater Accra here. There are 17 of them, and we have 10 in Tamale. If you add the two, we have 89. Thank you very much.
Thank you very much.
Yes, all these add to the 204.
Okay.
Thank you very much.
So if there was a speaker at some point, I think it's quite clear now for all of us to know. I am corrected also that the police representative who earned the punishment for us is ACP Lydia Donko, head of legal and prosecution in the Greater Accra region. So she will prosecute you if you are found in breach of the law. Now there are a few questions. How many test kits do we have? I think, okay.
Thank you. I think I missed that question. We currently have capacity for about 42,000 tests. We're expecting more test kits this week, and that will ramp up our opportunity to test more.
Okay.
And looking at the tests we have done, we're expecting that by the end of the period, we would have done a lot of tests.
Thank you. Thank you.
And we have capacity in Kumasi, Accra, and 2 centers in Accra, Kumasi, and by the end of the week, additional tests will be added for testing time.
You would recall that we mentioned that there are enough other facilities that could simply recalibrate their systems to join KCCR and Kumasi. They are being brought on board. Already one is on board now. Again, you will recall that at our last briefing, the Minister responsible for health informed us that as at that time, we had received a little over half of the about 50,000. We are now being told that we are hitting about 40, about 40,000 thereabout, yes. And we still expect more. Why? Because we've decided to adopt a strategy that goes in search of the virus and not wait for people just to be reporting cases. And that's why we're using this enhanced testing approach. Thank you. Now, the clarification in numbers has been done. Ayalolo, yes, yesterday we were informed that Ayalolo had halted services predominantly for some financial reasons. There was a cabinet meeting in which the President instructed the minister responsible for transport and the minister responsible for finance to quickly get together and resolve whatever bottlenecks there may be there, for which reason Ayalolo suspended services yesterday. Because especially at this critical time when you're asking people to socially distance on transport, you must ensure that the state transport like Ayalolo is functioning. So yes, yesterday we are informed that they suspended services. The ministers for transport and finance have been asked to get together and quickly resolve that bottleneck for us. Is the social protection program for Kaya Ye only? No, it's for the homeless and the vulnerable. I think when the minister was here, she mentioned even the numbers of the Kaya Ye they were looking at, and the disabled and other categories as well. So it is not for Kaya Ye only, it is for the homeless and the vulnerable. The minister responsible for local government has been asked to work with MMDCs in whose district restrictions have been imposed and the security agencies to ensure that social distancing takes place in the markets as well. We acknowledge that it is not being fully observed in the markets, and they have been asked to ensure that some more attention is paid to it. I want to take the next batch of questions. Yes, sir, your hand was up. The gentleman in purple jacket. Yes, sir. And then I'll go to the platform to take some questions. There was a question we didn't answer about regions. Say again? The Kolebu doctors. I'll let them speak to it shortly. But there was another question about regions. We will deal with it in the next batch of questions. Yes, sir.
No, I'd like to speak in the local dialect.
Please do.
Cases no was so but you see over here, I hope you other regions. You beat me, I can say, young class our regions no so as lockdown. You beat like as a senior, I could call other regions. You beat me nationwide lockdown now. I feel so. You're showing crossing, also, yeah. Hand sanitizer, I'm saying, some I had you over. I buy now, yes, she be in crossing my no. Or moon teaming to be no, a buyer she be so much warmer in classic phones in your hand sanitizer. Now, for social media, since because of HSA, there's vastly free amount ever, vaccine. If free amount ever say Ghana, Beja to Ma, and I won't go for my, you say, a home stem so intuit me clarify something from
yes, sir. Is there a vaccine coming? Is there a government program to put out sanitizers? Or are we contemplating a national lockdown? And then the old question about avoiding spread to other regions. Yes, sir.
My name is Nana Asante from Adom TV. Honorable, PP is not much. I didn't considering the security service and more year in the roadside
Okay. Thank you. Okay, we're done with the questions in the auditorium, or yours will be the last, and then I'll go to the platform so that we can wrap up.
But your friend is some over TV Africa. But some maybe say me question be say no psychologist no hospitals no man no nya psychologist na omo wo ho a omo nya yare ni bi no nya omo ho omo show man na so omo ekasa afa mu ko se mu ko test no ekoye ama ina si psychologist say na matter get you say Mudio yes exercise. Now I feel so me question back efa trotro no. Anga me free house never. Udru can shift first lighter. Police for ne soldiers na no so mo enko akra inside. No mo siw. Na so be na to kwan. Nti no so ye pese ye hu say trotro no ombe ye na wonye aduma. Yes.
Okay. What's some track you be fan say feedback. Ne dia ma team now coordinating the security side no na ometumi process no be improve no, but bottom line is a public transport continues to run as an essential service. Public transport including trotro say ekoso ayeduma the here say nipa betete omuntem so I think these are the questions from the auditorium, so let's take questions from the platform and then we'll wrap it up very quickly.
So there are three questions. One, we want a situational update on the doctor at Lekma Hospital who tested positive to the virus. Claims are that he has been deserted and left to his fate. This notwithstanding, his family has been exposed. Any plans to test them? The second question is, I learned the 8 Guineans through Burkinabes who tested positive for COVID-19 in family had been rejected by their home countries. Can the minister give update on the issue and the treatment being offered to them? Finally, government has allocated some 7 million cedis to trace contacts of infected persons. But for almost 3 days, we have been told one person who has tested positive is on the run and cannot be found. What is the challenge? Isn't the continuous disappearance of this one person undermining the work being done to limit the spread of the virus? Thank you.
Okay, so I'll just take a few and I would invite my colleagues to deal with the rest. Now, the person who escaped in Tamale and who the security agencies seek to locate is not somebody who will be located from contact tracing. Contact tracing is when we know there's a positive case and then we look for persons who have come into contact with that person and also have those persons engaged and tested. That one is a security operation. Indeed, arrest was made yesterday in connection with that one. But the specific person, as of this morning, I don't have brief, has been arrested. But it's an active option that the security persons are very keen on knowing the identity of such a person as well. A question about the 8+2, with a claim that they've been rejected by their home countries. I am not aware of that. What we are aware of is that the ministries of Interior and Foreign Affairs are working with their home countries or countries of residence to conclude the repatriation conversations and possibly repatriate them for treatment in their home countries. We have been required to substantiate or prove. Just like if you recall, when we were having the tango with our friends from the US, when you repatriate somebody to another country, there needs to be a certain establishment that indeed he's either resident in that country or is indeed a citizen. And that is a process that they are going through to complete that one as well. I'll leave the LECMA question for Dr. Abuaje. I'll leave the psychologist's question for the association. Ghana Health Service, do you have PPEs for security agencies? I'll leave that one too to you, Dr. Abuaje. Is it true there's a vaccine coming? The question, sanitizers, there is not a government program to distribute sanitizer to every citizen or everybody. No, there's no such program. But government is supporting various groups that are doing, and a lot of private individuals are also doing. Today, Maslock is here to make available some hand sanitizers which will be donated and distributed to some groups. I will let them speak to it shortly, but no, it is not a standard to distribute sanitizers across. I know a lot of members of parliament distributing sanitizers in their own constituencies. I've done mine. I know a lot are also doing this, but no, it is not a government program to be doing. What government is doing a lot of public education so that people can also help us at the last mile. So, Dr. Abuaje, avoiding spread to other regions, vaccines, PPE for security agencies, LECMA. Finally, speak to this question of a potential national lockdown. We have always said that cards are on the table. Currently, no such decision has been made. We don't have a reason or a basis to make that decision as at now. So we have mentioned, as the president mentioned, all the measures that he's taken are interested, continues to review them, and whatever needs to be done at any point in time done for the protection of the population. Dr. Abuaje, please come up to the microphone.
When you see them in town, you see all of them wearing masks. That's PPE. The TV Africa person also wearing a PPE. That's a mask. These masks are all PPEs. So they've been engaged. In terms of the other facilities, as part of enhanced contact tracing, all the other regions were asked to also enhance their contact tracing and search. And that's why you found a lot of regions looking out for people who just rushed in to find some assessment to see what they will do. So all of them are doing that. We have found a case in Eastern region, and that's why other places have also come up in this short time. So there is an enhanced listen. When we are talking about contact tracing, my contact, I believe in Accra, but my contact may be found in Tamale. And the system will go after that person. So the contact tracing and surveillance is all across the country, in every place where we need to find somebody. LECMA, we've been handling that, and I know from the regional director that a lot of has been done. Started contact tracing started. Those who have been exposed, the system is not too different from anybody who is found positive. being a health worker requires that we need to provide some additional support and counseling to ensure that other people don't get frightened to stop working. And so a lot being done by the region and the facility. And I think further details can be given. I'm sure some of these stories started long ago, it's been abandoned, but there's been a lot of things have happened since then, and I believe that nobody has been abandoned to their fate. We had some exposure at which, and they are also being taken care of in the same way as others are being taken care of. Vaccine. Ever since it started, many research centers are doing enhanced and fast-track approach to developing a vaccine. Ghana, like any other country, is ready and waiting for such an opportunity to take part. And so once there's approved vaccine, Ghana will certainly be, and this is a global program, so globally, they want everybody to have access.
But is there an approved vaccine now?
No, it's not approved.
I think we need to be categorical with that.
Going on.
Very well, thank you. Yes, sir, Doc. The question about psychologists.
All right. I must say that indeed, before the people who were quarantined are tested, they go through engagement with the psychologist, and the results also come out. They also get engaged with the psychologist. Even for those who may be discharged going home, the follow-ups. Social distancing requires that indeed face-to-face support be reduced. So it could even be done electronically. And most major hospitals, some private facilities also have psychologists. And the Ghana Psychological Association, with the support of Ghana Psychology Council, we are recruiting more people so that indeed, across the regions, as and when people get overly anxious and all that, we'll be able to support all these ones.
Thank you, sir. Colleagues, we were to wrap up our briefing today. And before we do, I have some very important announcements to make. Can I get the iPad, please? We acknowledge that while we keep talking of a national response program, there are specific persons who are the forefront of the program. They are the men and women who on a daily basis put their personal lives on the line to give effect to the national effort. His Excellency the President wants us to convey his appreciation to the frontline health workers who receive patients daily at health facilities nationwide, who do not even know the status of the next patient coming their way, who step up to the call each day to serve. Especially those also who are managing our 204 cases, and those who have helped us contact, trace, and take samples from about 6,000 people in the primary circle as of this morning. The President of the Republic and the people of Ghana are indebted to you. The front-end security persons who day and night also put themselves up to enforce the restrictions as have been imposed, especially the ones who also use the opportunity to help us educate the public. Your service, especially your firm, courteous service, is appreciated. The President of the Republic and the people of Ghana, thank you for your service. To our colleagues in the media, who from the very beginning have been instrumental in social mobilization and getting the millions of Ghanaians aware of the COVID-19 pandemic and how to prevent it. Excellency the President and the people of Ghana are grateful to you. COVID-19 ensem na omoboa bom ho ban ye bambofo a anopa ene anajo ewia omugina ewiam ni nsuom ehwese ya de aba no eye adwuma titiri wo mo a efa akwesa so edi tu nkofofo ede ye akyerɛkyerɛ kampani ni oman ni na adam ase ya doctor fo ne nurse fo a moboa man ahwɛ nipa be ya hanu ni enan a abre omanya yare bi wonuma eboa ana aboa stabre nipa mpem nsia a yetumi edomachi atwom hunsu a ye teste omo so ye do omase sana mo hospitals so a mo receive patients no mo nyina so yeda mo ase a eni kabia. As we wrap up, we have some donations to this morning. We are privileged to have with us the Chief Executive of Maslock, Mr. Stephen Amwa. Please join us. Maslock, we understand, wants to support the national effort with some contribution. Please join me up here and let us know what you have for the nation.
Thank you, Minister. We have been able to secure a large number of bottles of sanitizers. We've already dispatched them to 5 selected regions: Greater Accra, Ashanti region, Eastern region, Northern region, and Volta region. But here, precisely, we are here to support the good work our minister is doing. I think Ghanaians are grateful to you, Minister. You are doing much well. We are here today to present about 4,800 pieces to the security agencies out there, as if we knew along the stream of this program somebody raised that issue. I think it's very particular or critical. And we are doing this for them and for a section of the health officers that are also actually, I would say, compromising their lives. Is the stream word I will use. So, Minister, we are here. And then we realized Power West 2, there's a case. So we'll try to also send some there. But Maslow will continue to support you anytime that we are needed. God bless you. Thank you so much. And all the 3 doctors at Pukua, they are warriors. I'm also so seniors. I salute you. Thank you very much.
Mr. Amwa, thank you for your kind donation, about 4,800 pieces of hand sanitizers, and he's asking that it goes to support the frontline security, where we are very grateful to you. His Excellency the President and the government response team are the ones who are leading this charge, and all of us have an opportunity to support. They are doing a yeoman's job, and we support them. We're also happy to receive a donation from GASEM Unlimited. The Managing Director, Stefano, is here. Stefano, please join us and let us hear what you have for us.
Honorable Minister of Information, distinguished ladies and gentlemen, I'm honored to represent GASEM Board, GASEM Management, and all GASEM team here today. As you know, GASEM is a leader in manufacturing cement in Ghana. We have been supporting the country for 5 decades, and our commitment is to do it for another 5 at least. I'm happy and honored and proud to respond to the national call from His Excellency the President in trying to support this COVID-19 threat the country is facing. And so we are very happy to give a humble contribution, wishing that it will be useful to support this critical situation for Ghana and for all over the world. Mr. Ebenezer Sumua is our finance director here with us, so we are happy to donate today 500,000 CDs. As I said, wishing that it will be a humble contribution to fight this critical situation for Ghana and for all over the world. Thanks a lot, and we stand here to support even more in the future. Thank you. Thank you. Yeah. So we can leave it here. Thanks a lot.
Thank you very much, Stefano and the team at GASEM, for your kind contribution to the COVID-19 Relief Fund. The Office of the Chief of Staff will receive this check and duly acknowledge same. Plan Ghana, I'm informed, is here also with some support. Plan Ghana, quickly, please join me at the podium.
Good morning, everyone. Plan International Ghana is extremely humbled and honored to be here, Honorable Minister and other partners. Plan International as an organization, we stand and fight and support the cause of children at large, but it was a very strict focus on gender equality, focusing on how best to support the girl child, girls in general, young people, as well as women. We know that with this COVID crisis that we are facing, it's not a problem in Ghana, it's a problem that we're facing internationally and regionally. And because of the call, our president, in addition to the existing 5 program units that we have nationally in Ghana, we've actually set up an emergency response team currently to support government efforts. But we are also aware that the government, through the Ministry of Education, Ministry of Information, Ministry of Gender, Children, and Social Protection, they've different programs, and we felt that it would be extremely important for us to join hands with other key partners in Ghana